I'm live. Hi, this is Dr. Amigues, your friendly rheumatologist and host of the Unabridged MD podcast and Rheumatology 101. And I am trying to go live also on Instagram. And as you know, it takes a little bit of time, but here I am. If you're watching this on live, please write hashtag live. If you're watching this on replay, please put an hashtag replay that allows us to with AI that's looking at the views, it's allowing us to be in front of more people so that an actual rheumatologist is in front of people. Today, I want to talk to you about outcomes, about results. Why? Because as I was thinking about the role of Unabridged MD into the lives of the over 300 patients that I've taken care of, I have realized that it is not about just showing up. It is not about just having an appointment. And so I'm going to share with you one of the comments that a patient recently made. So as I rectified our diagnosis, so we thought it was rheumatoid arthritis. It turns out it's actually not rheumatoid arthritis. It is actually Sjogren. She told me, oh, there's an issue with LinkedIn. Well, we'll try later. That's fine. So she told me, I saw the rheumatologist. Sure. The issue is that as I saw her, another rheumatologist, she told me, this is the diagnosis. This is the treatment. Bye, I'll see you in 3 months. There was no understanding of what is this condition? What am I supposed to do? Why did it come? What am I what can I expect? And then basically, and this is what's happening basically because we don't know, because the most of the time rheumatologists or physicians in general in the insurance system, or at least the ones that are not in my in Unabridged MD, the issue is that they are not linked to an outcome or to the results. The truth is that I care about the results. I want my patients to have the best possible outcome. And to me, the best possible outcome is full remission. And remember, what is remission? Remission is the absence of symptoms, total absence of symptom with possible medication. So what that means by that is that you may have a medication. So maybe you have Plaquenil or hydroxychloroquine. Maybe you have a biologic. Maybe you have a combination of both. But you have no more symptoms, and you don't have any more steroids because we know that steroids actually cause harm in the long term, right? And so that's what I was thinking. I was like, wow, what I offer at Unabridged MD and what we want to offer at Unabridged MD is a result, is a life, getting back into a perfect life. So how do we do this? What is the approach of getting you to full remission? The first thing is to get a proper diagnosis. So a proper diagnosis is made by listening to you. What symptoms do you have? And that's the most important thing. And then if we see the symptoms, what's going on? What are the blood work? What are the x-rays or other imaging? Could it be possibly something different than what you think it is or what other doctors think it is? And so to do this, we don't look at other doctors' visit, because it's very well known that if you do, then you're biased because you're going to try to go into that type of diagnosis. So you want to be very open-minded to be like, okay, what is this? What can this be? Once you know what this is, it is so much easier to go and to say, okay, this is what it is, then this is the treatment plan. But the most important thing for me at that point, and so for the Unabridged MD approach, is to basically saying, look, this is what this condition does. This is what we know about it. Okay, so you understand what the condition is, and then this is what the treatment are going to do. If you understand the condition, you also can understand how the treatment is going to act. So then you're working with your body to heal, right? It's not the doctor that heals you. It is your body that heals itself with the help or not of medication, of lifestyle, right? And so then that is the approach is first diagnosis, second treatment. That's correct. That will work on the actual proper diagnosis, right? And then we see what the goal is. The goal is full remission. The goal is full remission if you have an inflammatory arthritis. And so to get there, we have many paths. Usually the path is immunosuppression until you're fully controlled. And then once you're fully controlled, once the fire is out, we can back off. And in addition to this, we work into understanding what does this condition brings to you. Okay. So it's not then just this idea of I'm going to see you, I'm going to give you a treatment, see you in 3 months. It's how are you doing? How are you feeling? What's going on into your life? What do you think are the benefits of this condition for you? What do you think are the benefits of having this condition and of making sure, like, what would be a disadvantage of not having this condition, right? Because sometimes you don't even realize that there is something very positive that you don't want to let go by not letting go of the condition. So for example, if your work is demanding, but by having a rheumatoid arthritis, you're actually getting some adjustment to your schedule, then without knowing, you're actually you don't want to let go of this adjustment of schedule. What if we could work with your employer so that you keep the adjustment of the schedule, right? And so that is very important to understand that. So then we continue to look at this, especially if you have what we call a difficult to treat condition, right? And when I say difficult to treat, it's just a condition that hasn't gone perfect with the first treatment. But we have many options, right? We have many options. And then we reach remission. Once we reach remission, and that is the goal, right? Then we wait a little bit and then we start backing off from treatment. The goal is to be individualized to you. It is not like, oh, you're coming to see Dr. Amigues. She sees you in 15 minutes. We are looking at this and that, and then we change treatment or not, and then bam. No, the goal is, are you in full remission? Do you have hope? Do you have confidence that this treatment is going to work? Do you see yourself healing? Do you see yourself in full remission? So, coming back to this comment that this patient had done, it made me realize I'm a rheumatologist, but I'm so much more than a rheumatologist. I'm here to help you heal fully, to help you heal so that instead of feeling like you have this condition and this is terrible and, whatever, like negative you would want there, you basically switch it and realize, oh, actually, I have this condition and this condition has brought me so much clarity into my life. That is the goal, right? The goal is so that when you're on the other side, when you're in full remission, you're not just back to where you were. You have moved forward and upward into your life. You are doing exactly what you've always truly wanted to do in your life. You're in full alignment with your life. That is the goal. That is what UnabridgedMD is here for, so that you are living the non-edited version of you. It is you fully. It's not edited by what other people are telling you. It is not edited by demanding of the society and norm. And no, it is fully you, so that you live a fully full life. Okay. So, yeah, I really wanted to share this because we can talk about nutrition, we can talk about lifestyle, but at the end of the day, I want you to understand what this UnabridgedMD approach is. It is a different approach, and you can look at the Google reviews on Google of UnabridgedMD or Dr. Isabelle Amigues. You will see the outcome of those patients are so incredible. It is truly the reason I'm here in life. Like, I don't ever imagine myself stopping being this healer that I am for you guys. Okay. So if you're watching this out until now, please tell me what you think. Like, what would be the perfect health for you? What are you envisioning for yourself? I want to see this. I want to look at those comments. Okay. And then I'm seeing some comments here. Spacey Man Jones. Hi. Hello, doctor. Long time no see. Yeah, I was on vacation for a little bit, and the truth is, like, and maybe I haven't seen you. That's what it is. I haven't seen you, so it's good to see you. I am wondering what your opinion is on farm-raised fish. I've heard mixed takes on its inflammatory and anti-inflammatory. Are there things to look for to tell if it's benefiting me or not? All right. This is so tough, right? So I'm gonna tell you my take on this. The first one is I do think that fish is better than meat. Uh, Meat has so much antibiotics now. This is, we give them so much antibiotics. So I don't think antibiotic is great because it changes your microbiome, which is, the population of normal, of good bacteria into your guts. And we know that there's a relationship between the gut and the gut bacteria and rheumatoid, like inflammatory arthritis. So that's the first thing. So farm raised fish, it's probably better than meat. And then honestly, when you start looking into it, you're probably also realizing that farm raised fish is probably not as good as the wild caught. But then if you start looking at the wild caught, you also see that this is not probably as good as it used to be because, right, like the sea is, it's not as clean as it used to be. And so at the end of the day, I think that you have to try things and to be in tune with your body and see how you're feeling. If really, if we were in an ideal place, you would eat whole food, plant-based, and you would take protein from plants. I'm like you, I'm very active. I need protein. I probably don't eat as much protein as I should. The truth is that fish is better than meat right now. If you have meat that's super clean and so on, and eat super organic, that's a different story. But if you're like me who doesn't have access to this, maybe I'm gonna get into a steakhouse, something very, very good, like a really good piece of meat, and I'm gonna do this like every 6 months or so. But yeah, I think the Mediterranean diet to me is the best. And it has more fish than it has meat. It has a little bit of meat here and there. It has more fish than it has meat, and it has a ton of vegetables. And to me, that is what I like the most. Okay. And that I recommend the most. Now, I don't want you to stress out about this because there's no point of stressing about diet. It increases your inflammation by being stressed. So take this with a grain of salt and realize that you're doing your best always. And then what's easier is to have food that's already made for you. So what I mean by that is maybe plan your meals in advance so you know exactly what you're going to eat. That's to me the most important thing. And then you mentioned something about movement by David. So I'll look at this. Yeah, and I'll look at this, and why not for a collaboration since he has psoriatic arthritis. Um, and then you mentioned, I think the most important thing for me and my condition, and that is not a centerpiece of my life. It's something I manage and think about from time to time. So that's absolutely right. You are you. This is part of you. And the same thing that I had stage 4 cancer, and it's still part of my life because I need to do infusion to prevent recurrence. Could I stop the infusion? Possibly. I don't know. The truth is that I have no side effect from it. So I choose to take them, right? And it's a very personal choice. Not everyone has that choice. Like, I'm lucky that I have zero side effect, right? And so I think it's exactly this. It's personally, the way I see it is that is part of my life, but my life doesn't surround about it. It's part of it. And it brings me annoyance because I have to get those infusions every 3 weeks. I need to make sure that I have an health insurance and so on. But it also brings me grounding because I have to stop every 3 weeks. I have to get hooked up to an infusion. And And that is grounding. Like when I'm not sure of where my life is going, or like I get stressed or whatever, I come back to this and I'm like, yeah, like this is not important. I'm living, I'm enjoying what I do. And so that is what it is, right? Like it is grounding me, and I see the value that this has offered me. And I think that that's really important, to be in the gratitude of whatever experiences in life you have, right? I wouldn't be the same person without this experience, 100%. I wouldn't be as happy as I am today without this experience. And this is where I want to bring my patients as well. Okay. So you mentioned something, Predator. Hi, very nice to see you. What food to avoid for arthritis? So I actually did a live, I think 2 weeks ago or maybe last week, about this. You could look into it. But in general, the pro-inflammatory for arthritis are sugar, anything processed, super prone for inflammation, and dairy, which is actually really a lot of sugar, dairy. Unfortunately, for a French person like me who likes bread, cheese, and wine, for arthritis, not the best. So recommending to do without. And basically try to, instead of thinking of avoiding, I would say choose veggies, choose veggie, choose veggie. And that is the thing that you want to get, okay? And then Spain syndrome. How often do you see patients continue to improve on their biolinks past the first 6 months? OMG. Okay, that is like one of the most important questions. I see so many patients who have been put on a biologic and their rheumatologists don't look at them. It's actually not the fault necessarily of the rheumatologist, but the system, because the rheumatologists are not seeing them. Maybe it's a physician assistant or nurse practitioner that sees them and doesn't realize that if at 6 months you're not responding, there's something wrong and we should switch it. So there is like a couple of, biologics where you have to like wait a little bit more, but like you should improve. And you can look at all of the studies. You can actually put your biologic name, the study, and look. And usually you see that those curves that are like going up, 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 and around like 24 weeks, they plateau. There's no more improvement. If you haven't improved at 4 months, you're not going to improve after. Like I don't see it. And except maybe for Rituxan, right? Like there's a couple of biologic, but if you haven't improved at 4 months, it's probably not working. Also, if you haven't improved at all at 3 months, like it's probably not going to work. You may have improved a little bit. And so this is what we see in my patients. Like you may have improved, and then maybe you're going to improve a little bit more. But honestly, at 4 months, if you're not at full remission, personally, I switch. And why? Because we have so many options. So that's my recommendation. Okay. I just want to make sure. I think this might be the case for me. Maybe I should attribute it to something else. But no, if you are not in remission at 6 months, we are doing something wrong. Switch medication. Don't wait. When you're waiting, you have more chance of erosion. You have more chance of more pain, more inflammation. It's more hard to get you in remission. There is a window of opportunity at the beginning of a rheumatologic condition. And even I've seen many patients after like 10 years, and they've tried many, like, no, actually they haven't tried many, because I don't know, for some reason, their rheumatologist didn't change medication. I think I honestly feel like some physicians don't care about the outcome. I'm realizing this more and more. And that's BS to me. I'm sorry, I'm like using words, because if it were them, they would care. If it were them, they would care. And I think it's like, maybe it's burnout. Okay, I'm sorry. You deserve full remission. You deserve minimal disease activity. That is what we call treat to target, and we deserve, and we should get you to there. And the only reason not to get there is if you have another reason to have pain. Okay, so that is super important, and that is something that your doctor has to look into and to tell you. And if, for example, if you have pain, we need to decipher, do you have fibromyalgia and rheumatoid arthritis? And if you have fibromyalgia, we can treat that as well, right? So just something to really like look into. And then what did you ask? Is there any advice you have for trying to incorporate alcohol in a diet with inflammatory arthritis? It would be nice to have some carefree and social situation. Here's the thing. Number one, clearly you're not in full remission. and that is nothing to do with your fault. It's not your fault. We need to switch medication. That's my recommendation. I don't know your story. I'm not giving medical advice. This is how I treat in general, right? And so I would recommend you discuss and you say, hey, I don't think I'm in minimal disease activity. I want to switch. I want to consider to switch. That's number one. If you're in full remission, you can get alcohol here and there. Absolutely not a problem. All right. In 2025, we can get you to full remission. I assure you of that. I assure you of that. I mean, it's simple. In my rheumatology practice in more than 20 years, I've never had a patient that has not gone into full remission. Sometimes it takes a little bit more time than others, but we always do. Okay, so that's number one. Number two is full remission means that you can have a little bit of alcohol here and there. Yes, there are things that you can do in your lifestyle to get the best benefit, but it's not the only thing that's going to get you to remission. And the first thing that we need to do is to get you to full remission with medications. And then your life is improved because of the diet you're doing, because you're not drinking alcohol as much as you used to, because you're not eating sugar as much as you used to. So again, I don't want you to be like, oh my gosh, I'm going to start drinking. No, that's not the goal. The goal is to get you to a better place than you were before. Okay, it's 20 minutes past. I usually try to get those in 15 minutes. Full of question, of course, but that's always wonderful. Hi, Dawn. Hi, Stu. Hi, 2022. Hi, Paul. Hi, Doc Dave. Hi, Palmer. Always such a good, it's always a pleasure to see you all. I'll see you next week. Until then, I'm wishing you a great week. And if you are in Colorado, if you want a second opinion, if you're interested in working with me, don't hesitate. Also, I'm about to start what we call coaching, but really it's the Isabelle Amigues and the UnabridgedMD approach. I'm about to start to offer this in everywhere. So meaning that it won't be medical. I'm not going to care for you. I'm not going to order medication and so on, but I'm going to actually coach you to get to full remission. And I will help you advocate for yourself with your rheumatologist. So come and work with me. It's an investment, but I think it's the best investment you can actually have in your life so that you can live a full and normal life. And that's it. I'm done seeing you guys suffer. It's time for full remission. It's time for result. Let's talk result. Let's work together. Okay? Take care. Bye-bye.